What are the normal ranges for inflammation markers in blood tests? Have you ever wondered what the normal ranges for inflammation markers in blood tests are? Understanding these ranges is essential, especially for those dealing with conditions like rheumatoid arthritis. Inflammation markers are substances in the blood that indicate inflammation in the body. When the immune system mistakenly attacks the joints, it leads to chronic inflammation, which is common in rheumatoid arthritis. Doctors use blood tests to measure these markers to evaluate disease activity and treatment effectiveness. One of the key inflammation markers is C-Reactive Protein, often referred to as CRP. This protein is produced by the liver in response to inflammation. A normal CRP level is typically below 10 milligrams per liter, with some laboratories considering levels below 3 milligrams per liter as normal. Elevated CRP levels can indicate increased inflammation, and people with rheumatoid arthritis may see their CRP levels rise during flare-ups. Another important marker is the Erythrocyte Sedimentation Rate, commonly known as ESR. This test measures how quickly red blood cells settle at the bottom of a test tube within 1 hour. The normal range for ESR can vary by age and sex. For men under the age of 50, it is usually less than 15 millimeters per hour. For men over 50, it is less than 20 millimeters per hour. For women under 50, it is less than 20 millimeters per hour, and for women over 50, it is less than 30 millimeters per hour. A high ESR indicates active inflammation and is often monitored in rheumatoid arthritis. Albumin is another protein made by the liver, and its levels can also provide insight into inflammation. The normal range for serum albumin is typically between 3.5 to 5.0 grams per deciliter. Low albumin levels can sometimes indicate chronic inflammation or other health issues, including severe rheumatoid arthritis. There are other markers to consider as well, such as rheumatoid factor and anticyclic sucralonitide peptide antibodies. While these are not inflammation markers, they are crucial for diagnosing rheumatoid arthritis and distinguishing it from other types of arthritis. Additionally, proteins known as interleukins, like interleukin-1 and interleukin-6, play a role in the immune response and inflammation, although they are not routinely measured in standard blood tests. Monitoring these inflammation markers is a standard practice in managing rheumatoid arthritis. These tests help doctors diagnose the condition, monitor disease activity, assess treatment effectiveness, and guide treatment decisions. It is important to remember that normal ranges can vary between laboratories, so it is always best to refer to the specific reference values provided by the lab conducting the test. Interpreting these markers is context-dependent. Elevated inflammation markers can occur for various reasons, not just rheumatoid arthritis. Doctors will consider symptoms, physical exam findings, and other test results when interpreting these values. Since every individual situation is unique, discussing test results and treatment options with a healthcare professional is essential for personalized care. Understanding the normal ranges for inflammation markers can empower patients in managing their health effectively.